Here in Cheshire and Wirral, we need mental health services that go beyond symptoms and illness. We need integrated services that see a whole person rather than just a diagnosis. We need support in a place that's right for us all to keep well, supporting our mental, physical and social needs. That's why health and care partners around Cheshire and Wirral are coming together to create a new, inclusive, community-based offer to make a significant difference for people in their local communities. The Cheshire and Wirral Community Wellbeing Alliance has been created to bring together organisations that provide mental health support for everyone in our communities, including primary and secondary care services, local voluntary services and local authority services.
So I think we've all seen, probably mostly related to the pandemic, but just changes in society that people are wanting different things, that they're talking about their mental health in a different way, and that we need to be able to work together with people with lived experience, with professionals, with wider services like housing and accommodation, so that we can support people with their kind of recovery goals, and when they experience a setback, there's a wider range of services in place to help them with that.
The idea is to kind of maybe somehow we can remove those barriers, make the services much more easy for people to access, and also maybe improve the quality of care which we deliver.
Our transformation is based on 5 principles that will guide how we deliver the best possible mental health care system for Cheshire and Wirral. Personalisation.
There tends to be this clinical recovery as such, where they look at people from a point of view of symptoms and reduction in symptoms, whereas we go at it from a personal recovery, looking at a holistic approach, looking at every aspect of a person's life. For people to get better, it's about them engaging in the whole recovery journey, about the potential that they've got, the ways they can move their life forward, to find meaning in their life again. And that actually helps them live with the condition, cope with the symptoms, and find such amazing strategies in order to just get on with their life and for it not to completely overwhelm them and take over.
CoProduction.
CoProduction is about co-design, co-delivery, and monitoring evaluation. And those are the areas that I think that we can really make a difference. And I'm only one of many people, so we've got lots of people with a range of lived experience, all contributing to this transformation.
Community.
We have generally have a very, very generic way of understanding the needs of population. So that's the first component to me. Community is to identify the needs of that particular population. And secondly, identifying the strength of that community.
Partnership.
Seeing the third sector as an equal partner in this is crucial for us really looking at transformation in its truest form. The bringing together of an alliance is exciting because everybody's coming together, they're pooling their ideas, they're pooling together what the communities are saying, and they're able to work with commissioners, with the different aspects of our system and say, this is what is needed and this is how we can deliver it in a different way to how you do that.
Equality.
It's about inclusion, it's about equity, but it shouldn't be just words. It should be reflected in the service we provide.
BAME women to be treated equally as other counterparts as well, irrespective of their color, irrespective of their age, irrespective of their background.
There's a real investment, and I think if it's done right, it can help a lot of people, and it could, have a real positive effect. Not as many people might then need to go into crisis teams or come into hospital.
Community mental health transformation is very much for the communities and the patients that we serve, but it's also for the staff as well. It's this opportunity to change how we've been doing things. Quite often staff in mental health services feel burnt out, feel that they aren't able to give the service that they so desperately want to give. But now there's a great time that we can change that.
This change for me actually brings to the heart of what community mental health is all about, And so, now is the time to make a real difference. We've got the opportunity, we need to grab it, and we need to really move forward.
Find out how you can hear more about the programme and share your views by visiting cwp.nhs.uk/alliance.